joint thyroid eye disease clinic is a multidisciplinary clinic. So in the same clinic, people see an endocrine doctor, they see an ophthalmologist as well, and they see the ophthalmology team as well. So they get proper assessment of their thyroid as well as their eyes. Because people with thyroid disease, with particularly overactive thyroid, can get problems with the eyes. Not everybody does, but some people do. And of the people who do, it'd be much better for them to get assessed in a joint clinic because it's a one-stop shop rather than going to different specialties, and it can be discussed properly between the different specialties and the best treatment offered to the patient. The endocrinologist looking after their thyroid disease should be able to tell them whether there is a joint thyroid eye clinic in the area, and if not, they can go to another region even if necessary. People who haven't got any eye symptoms shouldn't be referred because in around 50 to 70% they will not have any problems with the eyes. The other good news is that even the people who have problem with the eyes, it will be mild. So in around 90–95%, the condition is quite mild and it goes away. The beauty about it, it burns itself out. It will go away at some stage. So in the vast majority, it's either non-existent, there are no symptoms, or it is mild. So only the ones who've got significant symptoms, these are the ones who need to be seen. One thing to add to that though, that we've been encouraging people to refer to us even with mild symptoms so we catch it quite early. So if there are symptoms, people are having problem with the eyes, it's worth seeing an eye doctor early. When it comes to the treatment of Graves' disease, does it affect the eyes? The answer is yes. So let me take you through it. It's very important to maintain normal thyroid function, right? So one thing that we try to avoid is thyroid levels going up and down. Too high, too low, not good for the eyes. So one thing that we do in this clinic, that we do a regime called block and replace. So we put people on a high dose anti-thyroid drug to suppress the thyroid, put the thyroid to rest, and then we add in thyroxine. This way, you don't get fluctuation in thyroid function. Now, the treatment for Graves' disease, there are three treatments. There are tablets, there is radioactive iodine, and there is surgery. And radioactive iodine we do not do in people who've got active thyroid eye disease. That is best avoided. Now, once the active phase is over, it can be assessed whether those people can have radioactive iodine. There's no reason why they can't. Some precautions need to be taken. But in general, that's one treatment we do not give if they have active eye disease. Surgery is perfectly safe for people who've got active thyroid eye disease. The radioactive iodine treatment is usually given to people with Graves' disease who, for instance, had tablets, the treatment was stopped, and then the condition relapsed, so it came back. Because, you treat people with tablets, 50% will be fine once you stop the tablets after a period of anything between 6 to 18 months. You stop the treatment, another 50%, they will relapse. Now, in these guys, what do? Do you start tablets again? Do you go for radioactive iodine? Do you go for surgery? So radioactive iodine is one way to take the thyroid out without a cut. It just goes, the radioactive iodine goes to the thyroid and it kills the thyroid, so people go underactive. The problem with it, that if people have got active eye disease, it can make it worse, so we avoid it in that situation. The question whether people can develop eye disease after Graves' disease, the activity has gone, the answer is yes, they can, unfortunately. So eye disease can occur after. We see it sometimes in people with an underactive thyroid as well. Usually it is with the active phase, but we have seen it after as well. What we don't see usually, that people who had Graves' disease, then they went into remission, they are not on any treatment, they don't usually get eye disease. The eyes can be treated at any stage. So in terms of remission and eye disease, it's important to get the thyroid hormones in the normal range for the eye disease. But there's no reason why the treatment for the eye disease, for instance, steroids, can't be started when people are overactive. So we can treat both at the same time. Remission is perhaps not the word, is getting the thyroid hormone levels to normal range. That usually occurs quite quickly after we start treatment. But as I said, it's very important not to go the other way and go too low. And that's why we use a block and replace. But when it comes to thyroid surgery, taking the thyroid out, and eye disease, the good news is it does not make the eye disease worse. So unlike radioactive iodine, where you have that risk, taking the thyroid out will not make the eye disease worse. So in people who've got eye disease, they've got grave disease and they are fed up taking the tablets, or they've got relapsed grave disease, we do refer them for surgery rather than radioactive iodine. So it's perfectly safe for the eyes. Let me talk to you about the present first, and then I'll talk about the future. So when it comes to the treatment of thyroid eye disease, we use some very simple therapies, particular ones. We use selenium. And then people with more severe active eye disease, we use steroids quite a bit. We use it through the vein rather than oral steroids. In some people we use oral steroid, but we mainly use steroid infusions. And that works very well. It works in around 88% of people, so 9 out of 10 will respond very well. But then you've got some people who would not respond fully, and this is where these new therapies that we use. So we use some immune modulators, so these are quite strong therapies to modulate the immune system, and that helps with the eyes. Luckily, we don't have to use it that frequently, but when we used it, they worked very well. We can use other treatment, other immune therapies in people who've got long-standing disease. So we give them the steroids, they respond very well, we stop the steroids, it comes back. Again, we can use immune therapies, some simple immune therapies. There are some more therapies coming out now. They are very interesting, particularly one of them, because it reduces what we call the proptosis, which is the bulging of the eyes. And that bothers people a lot because how they look, which we completely understand. Those treatments, unfortunately, at the moment, they are very, very expensive. But I'm hoping that with more use of them, the prices will come down and we should be able to use them more. Are they the magic bullet? No. The reduction in the proptosis is quite small, but for some people that can be very important. But even with the therapies that we've got now that we are using, as long as we catch it early, we're getting some really good results. And people who are left with issues like the eyes bulging, we can do surgery, sort of corrective surgery, and people do very well on that. Radiotherapy is one thing that we can do as well, but that's all therapy, is nothing new. But overall, the important thing is to recognize the condition and treat it early. And usually the prognosis is pretty good, particularly when you have this multidisciplinary approach. And that's why we are so keen on having the joint thyroid eye clinic. People who are newly diagnosed with thyroid eye disease, it's very important to either see a multidisciplinary team, sort of thyroid eye clinic, or at the very least see an ophthalmologist, an eye doctor, to assess them properly. And people need to understand what the symptoms are. So they get redness in the eyes, swelling around the eyes, gritty sensation, really bad, or pain behind the eyes. All those are signs of an active thyroid eye disease. A little bit of redness is not a major problem, but when they get really red, it is an issue. And what we don't want to see is to get people at an advanced stage when the eyes are really bulging out and they've got various complications. So my advice would be that if anybody has got any symptoms related to the eyes and they've got grave disease, it's good practice to consult with the healthcare professional, the endocrinologist, because they can either look at them and say, no worries, this is very minor, don't worry about it, that's fine, they don't need referring, or this is now developing and perhaps an early referral is advised. So again, I stress, not every person needs to see an eye doctor. The majority don't, but if symptoms are getting worse, then it's better to see an eye doctor.